Hello, everyone, and welcome. Bill Hammond with Casey Elder Law Firm here, and this is our Casey Elder Law interview series, and it's my great pleasure today to welcome David Wiley from Kansas City Hospice. Welcome, David.
Thanks, Bill. I'm glad to be here today with you.
Yeah, you're very welcome. So, we all kind of know what the term, we know, we've all heard of the word hospice.
Sure.
And I think most of us might know what it is, but for those folks on here who don't, tell us a little bit about what hospice is and what you guys do.
Sure. Bill, hospice, it's a specialized program, and it's focused on end-of-life care, and it focuses on the individual and their family rather than the illness. And our hospice provides medical, emotional, social, and spiritual support. And it's centered around the quality of life and those considerations. And so when someone reaches the point in his or her illness where, a cure is no longer the focus of care, but instead comfort and quality of life becomes primary, then hospice is an important choice for people to be able to make.
Yeah. So, David, this is that whole discussion about curative care getting better versus palliative care, making someone comfortable. Is that right?
Yeah. I mean, curative care, aggressive medical treatment compared to comfort care, which is hospice. And technically, palliative care, means to provide comfort. So you can receive palliative care, frankly, at any stage of any illness, but it's often coupled with end-of-life care because we do that really well. We provide people comfort at the end of their life.
Well, and I hear that all the time. One of the things I hear from clients is, boy, I wish we'd known about it sooner. Because a lot of people think this is something that, someone does in the last 2 or 3 weeks of their life. And in reality, that's not true. So when should someone be contacting you guys?
First, I would just offer the opportunity for anyone to learn more about hospice and what we do, even if you don't need it. Because I hear that too, just like you, Bill. People always say, gosh, I wish I would have known sooner that you could have supported us. And so, but typically what happens for hospice to get involved is that a physician or some event happens where a physician recognizes that a person is terminally ill. They typically have 6 months or less if their disease follows the normal progression or through the normal trajectory of that disease. Of course, no one has a crystal ball. Nobody knows how long somebody will be with us, and that's when we get called in, and so that the physician will let us know, or sometimes family members who have experienced hospice before will call and say, hey, I think it might be time. And then we work with them to determine and provide an informational visit, in terms of which of our programs, and we have many, would be appropriate for that family.
Yeah. And accurate to say, though, that, you probably have people who are using your services for far more than the initial 6 months. I mean, things change.
It can happen. And, there's certification periods along the way. And so, but usually as we document and we observe those changes in someone's, their how their disease is progressing, and then we just recertify, and we keep documenting that. And actually the most important thing is we keep supporting folks at this important time of life. There's a lot of living that can go on at the end of life. And that's what we're really hoping for, is to be able to support people during this time with all of the services that are included within hospice.
Yeah, and is it accurate to say, David, that also, in many situations, you can do things that perhaps on the curative side they couldn't, to help someone stay as pain-free as possible during that time?
Yeah, we work to get as creative as we can, and a lot of times, frankly, stopping treatment helps people feel better sometimes. And so, and that's okay. It's a very personal choice. But from all of our interdisciplinary perspectives, whether it's medical care, nursing care, our social workers, our chaplains, our home health aides, we have volunteers, and then of course a really important part of hospice too is the grief support that's available after a loved one dies on hospice, and we support people for more than a year afterwards to help them adjust, and folks take advantage of that in different ways, whether it's phone calls or, well, today telehealth sessions are obviously important, but also letters and information and that we provide throughout that time period to help people adjust and address their grief.
Well, and I was going to ask you, and you kind of touched on it, I think you started to, how has the pandemic changed things?
It's changed things, I would say, pretty dramatically in terms of, we offer in-home hospice, for example. And so at first, people were, they struggled with wanting folks to be, our team to come into their house. But all of our clinicians are provided PPE to the fullest extent possible, not only to protect, of course, the staff, but to protect the family. So that's been a big change. So we adjust and we work with the family to based on their comfort in order to understand what they want to do. Plus, it depends on what's going on with the patient. We do have 2 inpatient facilities. So the Kansas City Hospice House, which is located at 120th and Warnell, and then we have an inpatient unit called North Care Hospice House inside North Kansas City Hospital. And so just like all medical facilities, there have been impacts related to the pandemic, related to visitors and that type of thing. So we've adjusted along the way, and we've made really important decisions for folks to be able to continue to see their loved ones, and we've had to get creative as well.
Awesome. And what would you say makes Kansas City Hospice unique then, David?
I think, on November 3rd, we're celebrating our 40th anniversary. Wow. So we've been doing this great work for 40 years. And we also have a full scope of offerings. So we do offer, like you mentioned, palliative care. And we have a couple different programs. Again, it's all centered on the goals of care of that patient. And we do in-home hospice. So that is wherever you call home, whether it's a nursing home or your house or apartment. And then we have the 2 inpatient facilities that I just mentioned. So, and those are typically for very serious, when symptoms are really difficult to manage in the home, and or families decide they'd rather not offer. And another unique thing, which nobody wants to think about, but is necessary, is we have a pediatric hospice team that's been in place since 1989. So, you don't want to think about it, but if you need it, you need an expert, and that's what we are. And we've been doing that for more than 30 years. So that's important and sets us apart, I think.
Awesome. So how will people best reach you? You said, important for someone to learn more about it. And so what should they do next?
They can call us, which at our phone number, which is 816-363-2600. And that they can just ask for somebody to call them back, and we're happy to do that. Or online, we have a website that's full of a lot of information, which is at kchospice.org.
Awesome. And the phone number one more time, David?
Yep, that's 816-363-2600.
That's fantastic. So, and folks, if you need help with elder care issues from a legal perspective, of course, we have offices in Lee Summit, Kearney on the Missouri side, Overland Park, and Corporate Woods on the Kansas side. And we offer free consultations, as I think most of you know. Give us a call at 913-338-5713. Again, that's 913-338-5713. Or visit us online at kcelderlaw.com. So, David, thank you so much for spending time with us, and I really appreciate the work you all do.
Thank you very much. I appreciated our time today, too. Thanks, Bill.